This week's class will offer some of the best clinical practices that bariatric providers have been implementing in their practices to prevent significant weight relapses and relieving a good deal of the psychological burden. Many of these practices can be utilized for weight management, loss and gain for surgical and non-surgical patients. These are some of the best practices offered by bariatric providers, and sharing your clinical best practices could help AABC fellows worldwide. Please continue sharing them with us. One of the most important tools that we use as bariatric counselors and educators is resting metabolic rate, or RMR testing. RMR testing is done with equipment such as the Core Review, which we've detailed in earlier courses. Since RMR testing has a CPT code, RMR testing is reimbursable with many insurance companies with an appropriate diagnosis. We are going to look at examples of RMR testing using 3 patients. The first example is a female patient weighing 300 pounds. The RMR report shows that this patient uses 3,000 calories per day or 21,000 calories per week. The second example is a female patient weighing 300 pounds. The RMR report shows that this person uses 1,800 calories a day or 12,600 calories per week. The third example is a female patient weighing 150 pounds. Her RMR report shows that she uses 1,800 calories per day or 12,600 calories per week. Note the differences and similarities between these 3 patients. For example, the first and second patients weigh exactly the same, but their RMR results are vastly different. And while the second and third patients' weights are completely different, their RMR results are exactly the same. Based on these RMR results, we can calculate the metabolic factor. The metabolic factor formula is RMR divided by weight. To apply the metabolic factor formula to patient 1, her RMR of 3,000 calories is divided by her weight of 300 pounds, which equals a metabolic factor of 10 or 10 calories per pound. Applying the metabolic factor to patient 2, her RMR of 1,800 calories is divided by her weight of 300 pounds, which equals a metabolic factor of 6, or 6 calories per pound. And finally, we apply the metabolic factor formula to the third patient. Her RMR of 1,800 calories is divided by her weight of 150 pounds, which equals a metabolic factor of 12, or 12 calories per pound. Again, note the interesting differences and similarities between these patients. Let's summarize the RMR data. Patient 1 expends 3,000 calories per day at rest, or 21,000 calories per week, and has a metabolic factor of 10. Patient 2 expends 1,800 calories per day at rest, or 12,600 calories per week, and has a metabolic factor of 6. Patient 3 expends 1,800 calories per day at rest, or 12,600 calories per week, and has a metabolic factor of 12. RMR represents about 80% of the number of calories that we expend per day. Our daily activity represents roughly about 20% of the calories expended per day. A simple clinical method of measuring daily activity is having patients wear a pedometer. Every mile walked expends about 100 calories. Formal exercise is not included in daily activity calculations. Again, let's note that the second patient weighing 300 pounds and the third patient weighing 150 pounds have the same RMR, which means that they expend the same amount of calories, yet have very different weights. The dictates of energy balance for both patients, calories in and calories out, are the same. Therefore, If both patients replace their identical energy expended with energy consumed, calories in and calories out, patient 2 would remain at 300 pounds and patient 3 would remain at 150 pounds. This presents a familiar conundrum. If both eat about the same amount of calories per day, in this case 1,800 calories, why would patient 2 continue to weigh 300 pounds while patient 3 remains at 150 pounds? AABC has identified the metabolic factor as a method to quantify a predisposition for obesity. The metabolic factor of patient 2 is 6 and patient 3 is 12. Patient 2 has 6 cylinders, so to speak, and patient 3 has 12 cylinders. They burn fuel, food, at very different rates. What we are identifying as a metabolic factor can quantify a predisposition for obesity. Bariatric clinical impressions and experience has demonstrated that while a patient's weight may go up or down, their metabolic factors remain constant. In fact, we can make useful predictions concerning weight gain using the metabolic factor. For example, what if patient 3, who weighs 150 pounds, gains 50 pounds? At 200 pounds, we can predict that her RMR will be 2,400 calories per day. In another example, what if patient 2 has bariatric surgery and reduces her weight from 300 pounds to 150 pounds? We can predict that her RMR will be 900 calories per day. RMR testing is often conducted to determine how many calories one needs to sustain their current weight. Using the metabolic factor formula to predict how many calories one needs per day to sustain a lower goal weight is extremely useful. The spectrum of obesities has many common presentations with different etiologies. Patient 2 has a very low resting metabolic rate and low metabolic factor. She has attained a body weight of 300 pounds not as a result of hypophagia, but as a result of being hypometabolic. This is a woman who might have reported not eating a lot to health professionals who likely have been suspect of her veracity and dismissed her reports because the scale reported 300 pounds. As a result of RMR testing and bariatric math and your understanding of this lesson, patient 2 has finally found scientific evidence of what she has not been able to successfully communicate to health professionals. I do not eat a lot. The RMR metabolic factor revelation will not mediate her weight or physical health comorbidities. However, her mental health comorbidity has substantially been mediated. It is likely that she will develop confidence and trust in bariatric professionals that perform and explain RMR, metabolic factors, and bariatric math. Patient 2 has a goal weight of 150 pounds, and her metabolic factor is 6. 150 pounds times a factor of 6 equals a RMR of 900 calories per day. If we added an additional 200 calories to her physical activity and assume that she expended another 200 calories in her chosen formal exercise, her RMR of 900 calories per day plus her daily activity of 200 calories plus her formal exercise of 200 calories, this would equal a total daily calorie expenditure of 1,300. While it is not impossible to sustain 1,300 calories per day, it might be an unrealistic long-term goal. Having this bariatric data available and knowable, she might choose a weight goal that is easier to successfully sustain. Not knowing a patient's RMR metabolic factor is one of the reasons that many patients choose unrealistic weights that they cannot sustain and why relapse rates are high. Knowing that a patient is hypometabolic is important, not only in choosing realistic weights, but also in choosing a restrictive or malabsorptive procedure. For example, lap band may not be a treatment of choice for hypometabolic patients that have never had high caloric needs. Class 9 will continue with some of the best clinical practices to prevent relapses.